Great. So like I said, my name is Sue Grinnell, and I am with the Population Health Innovation Lab, and we are a program of the Public Health Institute. And the Public Health Institute is based in Oakland. And generally, when we start convenings where we bring people together, we like to acknowledge the land that we are all residing on, and we respectfully acknowledge that we live and operated on unceded land of Indigenous peoples throughout the US. And I believe Max, thank you. Just some of you may be familiar with this, but there is an amazing website that has a map for people to go and see where you live and what lands that you may be residing on. So thank you. So just a little bit about us. Some of you I know, some of you I don't know, but we have been at the Public Health Institute since 2015, and we are an innovation lab, and we love to work with health-focused multi-sector collaboratives. And we do a lot of learning collaboratives and just meeting design and facilitation, do a lot of training, right, on systems thinking, systems work, partnership development, multi-sector collaborative. We also do research and evaluation and communication support. So what we wanted to do today is just welcome you. So thank you for coming. We're very excited to be with you and hope this is a beginning of a beautiful relationship over the next year, and really look to you all because you all have a lot of wisdom right around this. Like I am not an expert on enhanced care management or community supports or CalAIM. I think every day I learn something new. So we really welcome having you be here with us. We're going to do a short overview of this collaborative planning initiatives. We then are going to do some breakout discussions. So you'll have the opportunity to be with others that are here. We had quite a few people that registered, but it's often normal for people not to be able to attend. And so, you know, I'm not sure exactly how many people will be in the breakouts. And then we'll do full group coming back and then closing and next steps. So for us, we just wanted to make sure that we provide the opportunity that you can understand the purpose of the PATH collaboratives. I know I've been in conversations with a lot of folks, and there's questions and curiosities about what is that, how is it different than what maybe they're doing or has already been in place. It's also an opportunity, I think, to build relationships. Hopefully there's somebody here that you've not met before or that you don't know. We heard that a lot, like people want to know what people are doing and who's out there. And this really is an invitation that we are giving to you to help us to shape this. This is really about you. You are all doing amazing work, and we want to provide the opportunity for you to help to shape what's going to work best. Next slide.
Well, I think, Sue, it is time for us to do a quick poll.
That's right, the poll. Excuse me.
Yep. So I'm going to stop sharing.
Thank you.
And we just want to get a quick sense of who is in the room. Where are you all at? What are you focused on? So I'm going to launch a poll. There are 3 questions to this poll. The first is about which county or counties you work in. Select all that apply. We realize there's a lot of overlap here. The second is about what describes your organization. Again, you might fall into multiple buckets. Feel free to select more than one if that's appropriate. And then finally, which services your organization provides. Again, select all that apply. So I'm going to go ahead and launch this poll. Remember, there are 3 questions there that you should see. And I'll give everyone about a minute to respond to these, and then let's check out our results and see who's here. All right. So I'm ending the poll. Let's check out what we learned here. Can everyone see the results that I just shared out? All right. So we see here, I'm happy to see that we have someone representing every county in the 2 regions we're working with. So that is great to see here. And we also have a nice distribution across healthcare, social services, and CBOs, but we are missing our public health and MCP partners. I hope that we can meet up with them at another time. We also have some county, city, and local government folks here, so that is great to see, as well as some
Hey there,
others.
this is Colleen Townsend. I'm actually here from the Medi-Cal Managed Care, the MCP Partnership Health Plan.
Oh, wonderful.
But I'm on my
Thank
phone.
you.
I can't get into the site. Thank you.
Oh, got you. Thank you for letting us know that you're here. So we have great representation. And then we also see that many people, so let's see, 17 folks said that they provide ECM, enhanced care management services. Lots of people are providing housing services, respite services. And there are a few where we don't have representation. So let's see. So thank you all so much for taking a moment to respond to this poll and give us a sense of who is here and who and what kind of services are represented in this group. I will now hand it back over to Sue to take it away with some path intro, and I will get the slides back up. Sue, you muted?
Of course I am, right? You'd think after 2 years of doing this, we would all know when to take our mute off. So what I realized that I didn't do, and I apologize, is do an introduction of the other Phil staff that are here. So I'm going to start with Catherine Stewart. She is here and she is our Division Director for Learning and Action. We have Stephanie Bultema, who is just doing the poll, and she's the director of our research team, otherwise known as Merlin. We have Max Chavez, right, who is a research associate. And we have Esmeralda Salas, who is a research assistant. And Stephanie Hartsfield is with us, and she is a consultant that will be supporting this work. So thank you for that. So I wanted to just spend a couple of minutes, just giving some orientation about this initiative. And so I think, just starting with CalAIM, California, right, has CalAIM is the name of their 1115 waiver. That a waiver is now in place for about a year. I think in 2021, the end of December, it was approved, and they typically are 5 years. Under the 1115 waiver, and in California, it's known as CalAIM, they have a boatload of different initiatives, and it's really a lot to track and a lot to kind of manage and understand and see how they're all related. One of the initiatives that's under CalAIM is PATH. And under PATH, there are a variety of different initiatives. And today we are focused on the Collaborative Planning Initiative, or CPI. So what's happening in California, right, is DHCS identify regions. We did not identify the regions. So I'm not sure honestly how they came up with the regions. I know that people that I've spoken with have questioned why are certain counties together. They are what they are, and I think we're going to try to figure out how do we move forward the best way that we can. And Phil was asked to apply to serve as a facilitator. So there's a number of facilitators across the state. Each county and or region has some form of a collaborative planning group that's planned or it's on the way. I think this month is when things are launching. And at this point, it's for the next year. I'm not sure after this year what will happen. And so these collaboratives that are being formed may be existing. So some of you might have been participating on a collaborative, like maybe as part of a whole person care pilot or some other existing. I've talked to a number of folks who it sounds like there's some groups that have been meeting. I'm not sure this will be what we want to learn is it for the same purpose? I mean, this is very much focused on filling the gaps and the needs around enhanced care management and community supports in the region. So participants can include managed care plans, local governments, that could be county, regional government agencies, healthcare providers, CBOs, hospitals, Medi-Cal tribal designees of Indian health programs, and of course, ECM and community support providers. So the focus really is to identify what are the pressing needs and gaps in the current ECM and community supports in the region, identify any topical implementation issues. So there's a lot of things that have come up about workforce, data sharing, care coordination platforms, all kinds of things that are maybe barriers and or opportunities to getting this work done. So I think this is where this group can really, what's most important to this group that you want to work on to resolve. Also, just looking at how PATH and other funding initiatives related to CalAIM can be used to address any of the gap filling plans that the MCPs are required to do. I think I'm hearing a lot more about this concern about duplication of funding. Some people are very concerned about that and making sure if they're tapping into certain funding that they're not getting sideways with something else. Next slide. So we as facilitators are responsible for convening the two regions. So there'll be two separate meetings once a month. So there's, our work plan is really on a quarterly basis, right? That we have to have a meeting once a month. And we really are looking to engage a pretty diverse set of stakeholders to help to figure out, what are the challenges and the conflicts and how do we work together. We want to make sure that we're doing a lot of outreach. So I feel like, this spreadsheet of names that we're creating is constantly evolving. Just related to that, I'm not sure how many of you have actually registered to participate in this. So DHCS has a website where you can actually go to register. And if you have not registered, I would encourage you to do so. It helps us to know who is who. There's also a set of questions that are there that are really helpful to see what are people interested in and maybe other partners that you think would be important to be engaged with this. So that's really important. So we want to keep doing outreach, in particular organizations that are serving historically marginalized populations. Today, as a side note, there was a PATH facilitator meeting. This question came up of what's the definition. I'm not sure that they have a definition at this point for historically marginalized populations. So once we do, I will make sure to communicate that back. Identify potential resolution strategies to overcome the challenges and the conflicts. Really, so I see this really as a very solution focused. I think you've probably all come up with some solutions. I think we do have partnership with the MCP, and I think they're very much engaged in helping with that. So the other thing is, right, what kind of topics are people really interested in learning? In that registration that people did to participate in this, there's a number of different topics, one of which was cross-sector care coordination. That was probably one of the highest in terms of there was a lot of interest. So we will be offering a session for people that, oh, thanks, Catherine, for doing that. I appreciate that. We will be offering sessions like this. Some of you may want to offer sessions. I think we really want this to be a space of learning and solution. Great, next slide. So before we dive into the listening session, I just want to kind of recap. We are building out a website. So there is the DHCS website. You can go there and I think it has a link to our Phil website. We don't at this point have a specific PATH CPI website, but we're going to build that out and we'll be able to post materials and information just as your resource. Like I said, that we are going to be doing 4 listening sessions. So this is the first one. We're doing 2 for the Southwest region, and that is I'm going to name them: Lake, Marin, Mendocino, Napa, and Sonoma. We're here for the Southwest. And then the Northwest is Humboldt and Del Norte. So we're doing 4 of those. Once we are complete with those, we will do a synthesis and make that available for you. Like, what are people saying? What's most of issue and concern and interest? We hope to have regular meetings. That's our plan. We are really looking to do in-person as well as virtual. I'm not sure. I know everybody has kind of a different feeling and just about coming together. But we think it's a nice opportunity. Hopefully, if all of the variants, who knows what's going to happen with COVID. But our next for this group would be February 23rd from 12:30 to 2. We will be sending out a note for people to invite you. And then we will plan on doing this cross-sector care coordination training. Stephanie, who's actually here today, will be hosting that. She has lots of knowledge in this space. We don't have a date yet, but we will make that available. And then planning and asset mapping. I think one of the things that we heard a lot in the different conversations is people want to know what the assets are. Where are they at? How do we figure out who's doing what? And how do we use that information to move forward? As part of our work, we are charged with bringing together the collaboratives who are interested in furthering enhanced care management and community supports. And we'll be working on project charter, a change package, aim statement, key driver diagram, and measurement strategy. These are all things that are required and will be informed by you all from opportunities such as this, the listening sessions, as well as any surveys that we do in any of that. So I don't think our intention is just to create something and have you sign off on it. We really want this to be something we do together. So I think, just before I turn it over to Stephanie, excuse me, for giving some framing for the listening session, I just want to see if you have any questions or anything you'd like to add or anything I didn't say, team. There's something I missed. I know that was very high level and maybe brief. So. Okay.
Hey, Sue, actually, I have a question. Maybe I missed this in your presentation, but is part of the intention also to take this feedback back to DHCS, or is it really more a collaborative to like support those who are here, like convened within this group?
Mm-hmm. Jessica, that's an amazing question. I mean, I think that I would probably want to get back to you. I think there is kind of the way that this is working is it's DHCS funding. There's a third-party administrator. Maybe you've heard of this called Public Consulting Group. They're actually based out of Boston. And so we actually have the contract with them and they're working. I honestly don't know. They seem to have a pretty good relationship today with DHCS. So if there are out of our themes of the information that we're hearing, like today, just right before this, we had an hour-and-a-half meeting. They wanted to know what are the challenges, what are the barriers? And so I think I would hope, but I will follow up, Jessica, like what are they doing with that information? Like, are they going to take it back to DHCS? And if there are some leverage points, particularly that this group has identified, like in terms of systems changes, I would hope that they would be open to hearing that. So thank you. I think that's a great question. One of the things I wanted to share, and I apologize, I didn't do this earlier, that I heard because I thought maybe some of you might be interested, is that there's going to be, I guess, 3 rounds of this cited. So there's PATH cited, right? This is another under PATH, all of these different nodes of it. And there were 232 applications that were received from 206 organizations for a total of $520 million. And I don't know if any of you've applied for this, but it sounds like that the announcement of who is going to be awarded of those funds will be very soon. They didn't say a date, just soon. So hopefully that is soon. And then there are a total of 383 individual organizations who have registered across the state for this initiative, right? So again, I just think it's really important if you've not registered to go ahead and do that. I think it helps us, but it also helps them to see who's involved.